2 more COVID-19 related deaths and 85 new positive cases have been recorded. The latest figures from the Ministry of Health bring the total number of active cases to 630. The number of deaths now stands at 148. Both persons were adult males with comorbidities. This also means the total number of positive cases for the month of April so far is 570. The ministry says the new cases reflect results from the samples taken during the period April 11 to April 13. 66 patients are at hospital, while 247 people remain in state quarantine facilities. To date, 11,686 people have been vaccinated. Stricter COVID-19 measures come into effect from midnight. Among the new restrictions intended to put a halt to rising COVID-19 cases, beaches are now closed to the public and the number of persons allowed to gather in public has been reduced. Kimberly D'Souza has more.
From midnight on Wednesday, persons will no longer be allowed to dine at restaurants, bars, casinos, or cinemas. This is among the measures announced by Minister of Health Terence Yalsing, who said his ministry noted an increase in COVID-19 cases following the Easter weekend.
The simple logic, as Dr. Trotman has said, is to reduce congregation and to reduce the ability of the virus to jump from person to person in situations where masks cannot be worn.
The number of persons allowed to gather in public has been reduced from 10 to 5, and Minister Yalsing encouraged everyone to observe the same rules while at their private residence. Minister Yalsing also announced another measure that will impact public gatherings.
So all beaches from midnight to night will be closed to the public. The exception is going to be made for persons involved in the conservation activities for the leatherback turtles. They can still go on to their beaches.
He said beaches located down the islands will also be closed. The health minister reiterated the policy that party boats are not allowed, but he explained boat tours, both in Trinidad and Tobago, will continue to operate without music. While gyms and religious institutions remain open, he urged religious leaders to ensure their members follow the current COVID-19 protocols.
Make sure persons attending church services, mosques, or temples stick to the 50% capacity, and most importantly, make sure that once these persons are in your places of worship, masks are worn at all times.
The measures will be in effect for the next 21 days. They are an addition to the COVID-19 public health measures currently in place. Kimberly D'Souza, TTT News.
Tobago hoteliers and restaurateurs are describing the latest COVID-19 restrictions announced by the Minister of Health as unfortunate. A despondent president of the Tobago Hotel and Tourism Association, Chris James, told TTT News they recorded an occupancy level of 79% during the Easter period and are now down to 18%.
It's going to be difficult for the business places as we were trying to get going, but it's understandable if cases are spreading.
Meanwhile, the association's former president and restaurant owner Nicholas Hardwick shared similar sentiments. However, he said he's confident that this decision was made based on substantial data collected.
It's unwanted as far as anybody is concerned, but more than likely necessary as a circuit breaker to the current trend that we see going on. So, hopefully everybody takes it seriously. Everybody, adheres to the social protocols that are in place. Doesn't drop their guard, because it is going to mean more economic hardship for workers, for business owners, for suppliers throughout the hospitality sector.
Mr. Hardwick hopes that after the 3-week period and some improvement is made and in-house dining can recommence. As he stressed, for restaurants like his, takeout is not economically viable. There has been a steady increase in positive COVID-19 cases. This according to epidemiologist Dr. Avery Hines, who said the epidemic curve shows an increase in the number of COVID-19 cases in the month of April.
January in green, February in blue, March in orange, and April in purple, with that rolling black line demonstrating the 7-day rolling average. And if we can see it clearly, we can see that that rolling black line has taken a steep upward turn and continues upward at this point in time, another cause for concern.
Dr. Hines said the rolling average has taken a steep upward curve and continues to climb, especially for persons with respiratory illness who would have tested positive for the virus.
Last bar showing that we are in the week 15. Week 15 isn't finished yet, so it's an incomplete week. But the background color, that salmon section, showing all levels of positivity, meaning the number or the percentage of individuals who have been tested for respiratory illness and have come back as positive for COVID-19. And we see that that would have increased from around 2 to 3% in February, all the way up to about 15% at the current time.
The epidemiologist also noted an increase in COVID-19 cases along the east-west corridor.